Hello everyone, I am Gopika SP, doing my undergraduate in Biomedical Engineering from TKM Institute of Technology, Kollam. Today we have Ms.Greeshma Alwin, BSc Nurse at Tariq Hospital, Bahrain, to share some valuable information about ECG machine. So we can move on to the session. I, Gopika SD, welcome you all to the professional interview session of ECG machine, coordinated by Group 5 of Biomed 360. Biomed 360 is a campaign jointly initiated by IEEE EMBS Young Professional, IEEE student volunteers, and biomedical students across Kerala, with the aim of unleashing various medical devices to common people. To a very informative session on ECG by Ms.Greeshma Alwin, BSc Nurse at Dermatology Department in Tariq Hospital, Bahrain. She worked with Mumbai Jupiter Hospital for 1 year in organ transplant unit, also worked in medical ICU for 16 months in Elite Mission Hospital, worked with Shifa Al Jazeera Medical Center Bahrain in emergency unit for 6 months. As of now, she has 5 years of experience in various medical departments. I had prepared some questions regarding ECG. Ma'am, I'm
Okay.
moving on to my first question. Ma'am, can you tell me what is ECG? Can you explain it in simple words?
ECG actually it is a simple method to detect cardiac problems because it is a medical test that is ECG method to detect heart problems, measuring the electrical activity also. So the activities like electrical impulses the chest leads are catching, and the activity is like in a paper record. So we can detect the cardiac problems in a quantity, not quality. Quantitative method, we will get the heart problems.
Basically, how and what does an ECG test do?
ECG, ECG test actually it measures the heart problems. Even if the different varieties of heart diseases are there, no. So each diseases there is each pattern of ECG. So each pattern refers each diseases. So we can identify each diseases because the patterns is differs in each disease. So we can identify the all heart problems, including the heart block and myocardial infarctions. It means the heart attack, and even the genetic abnormalities like inborn problems, no, like in valve problems. We can detect that all problem, and any irregularity in the rhythm rate, we can identify the problems of the heart overall.
I am asking this question out of my eagerness to know your experience in the field of ECG. I mean, that is working with an ECG machine.
It is actually it is a painless method for the patients, not invasive procedure. So it is easy to do the test. Then even if we can do it is in the bedside, no need to do in very big lab or something. We can keep the machine to the patient side and we can do the test so that we can identify in the bedside. So it is the actually it is the most first method to do in the bedside. Even if the patient is coming with the any dizziness, any chest pain, any shoulder pain, so sometimes some patients are it's presenting as like gas problems. So in the bedside also we can take the test. And in my experience, it is the most relevant method to detect the cardiac problems.
Okay,
And
ma'am.
the placement of leads it's a little bit difficult, but it's as we are doing regularly, it is easiest for us.
We had heard about 3 lead, 5 lead, and 12 lead ECG. Ma'am, can you
Yes.
say how these differ from each other?
Three lead ECG means only three leads. Only three leads are placed on the chest. One in the right side of the heart, right side of the chest, one in the left side, one is the left lower side. So only three leads. So, but we can get the not in detail. We cannot get the problems in detail, but we will see. We will get the problems. And five lead means there are five leads like both in the right side and both in the left side and one in the chest middle portion. So this is also it's in the right atrial part, left atrial part, the chest part, like 5 leads. But the most relevant method is 12 lead ECG. 12 lead means we have 6 chest leads and 4 limb leads. Chest leads means the 6 leads we will place on the chest of the patient, and there are 4 limb leads in 4 limbs, 2 in the right side, arms and legs, left side also 2 leads. So it is the accurate measurement, we'll get accurate measurement. So in 5 lead methods, we need to press each button for each, actually there are 6 methods, like lead 1, lead 2, lead 3, like that there is. So we need to put more options in the ECG machine. But if 12 leads mean, we will get in one print, and it is, we can know. Sometimes the machine itself, it will say what is the diagnosis. So 12 lead ECG machine is the most relevant and a good one.
Nowadays, ECG test is mandatory and prime test taken on a cardiac patient. I would like to know why this test got a prime importance.
Prime importance means no need any blood test like that, no. So it is relevant method and it is the easiest method. So we can identify the test within minutes. The placement of leads may be take, it will like 5 minutes or 10 minutes, but the test result will give like immediately after 1 minute. Like the duration of the result is very less. So the, if the doctor is in beside, we can identify, we can diagnose the problem. So that's why it is more relevant and more important. Sometimes the blood test, it will take time, no, it is and the patient will not feel any pain. It is a painless method and it is non-invasive. We need to prick, we don't need to prick, it's just place the leads. That's only, that's why it's the prime important method.
Okay, ma'am. Moving on to the next question, I would like to know what are the procedures or how will you take an ECG test on a fully burned or severely injured person?
Actually, it is very difficult to take for the fully burned and injured persons, because injured persons, maybe all the areas will be injured. Burned persons mean the skin is very peeled off, and the patient is, we cannot place the leads properly. In that case, if the, we will first identify the type of burn. Like if it's in the legs, arms means it's okay. We can take with 5 leads, but in the chest is burned means it's very difficult to take. So in that case, if the person is if the heart, if it is more than 50% burn means, we need to take the, we need to keep the patient in a sedation. So in actually in fully burned patients, we will take the ECG with we will cut the end of the leads. There are different machine and already they made cut, and that only the probe is placed on the chest, not chest, the even the both shoulders and one in the lower left side of the chest. So we will make the patient sedate, and we will actually that probe, no, we will put with the stainless sterile stapler, so that we can take the ECG. But only 3 lead ECGs will be, will get on that burned patients. Very difficult to put 12 lead ECG. Only the probes are keeping with the like stapler. The probe, no, it's in the cut, the what it is called, like the end of the probe, no, we will make one cut and we will put the tip with the stapler on both sides of the chest. One in the right shoulder, one in the left shoulder, one in the left lower side of the chest, so that we can get the ECG.
Okay, ma'am.
Anything else?
Ma'am, what is the biological reason behind placing that leads in certain places like a right leg, left leg, and so on?
There are certain leads like chest leads and limb leads. Limb leads usually we are placing in 4 limb leads there and 6 chest leads. Actually, it is saying 12 lead ECG, but actually there is only 10 leads. But if the 10 leads will get 12 electrode. That's why it's called 12 lead ECG. So the placement means chest leads are important. There are V1, V2, V3, V4, V5, V6, and there are 4 limb leads: right arm, right leg, left leg. And this leg placement, no, it's only the referent electrode for the legs. Actually, the electrical activity we are getting from the chest leads. And the legs placement, it's the reference for the any minute electrical imbalance. No, it will we can notice from the limb leads. I think so, like that. This is a reference electrode for the actually for the recording purposes.
Yeah, okay, ma'am. Ma'am, can you tell me what are the difficulties that you have experienced as a nurse while readying the patient for ECG?
It's very difficult to take the ECG for very hairy patients. Like if some male patients, know the chest is full of hair, so it's very difficult to place the leads. So we need to shave the chest before doing the placing the leads. And in some cardiac patients, in case like heart attack or heart attack, no, the patients will be severely sweat. Always they will be in sweating. So the moisture, no, it will not keep the leads to be in safe. So we need to wipe the chest. Then only we need to keep the leads. And it will not, the gel, no, it will not be sticky if the surface is wet. Sometimes psychiatric patients, no, they are restless, so we cannot make the patient still in the bed, so we need to make them asleep or need to sedate them. Then only we can take the leads for the psychiatric patients. In case of kids also, we need to keep them still, so otherwise there will be artifact, like what it is called, differences. We will not get the correct measurement. So this is the most difficulties I feel.
Okay. Did you feel any more innovations are needed in the ECG machine?
Innovations means some patients know, usually female patients, they are very shy to take the ECG. So if any new company can invent ECG machine for putting those on the dress without any clip or any metal, we can use the plain dress, no, and over that if ECG is getting means it's better. So they cannot we can keep the patient's privacy.
Okay, now, ma'am, now we are moving on to our final question. What do you think about conventional mode of ECG test in hospital and ECG monitoring through a Apple smartphone watch? As a
I don't
nurse,
think so the Apple smartwatch is good to measure the heart problems, because it can maybe it can keep the heart's normal rhythm. But in some cases like cases like left hand, so atrial fibrillation, ventricular fibrillation, lot of cases, I don't think so we can detect from the Apple smartphone. The conventional method is the better. So I don't think so the smartwatch, maybe they can it can see only the rhythm only we can see, but I prefer only conventional method, not the
okay,
smartwatch method.
ma'am. Okay. If I had missed anything, or if you want to say a bit more about ECG or about your experience, please be free to share with it.
ECG, actually there is no need to do with any sterile procedures, like it's not a sterile procedures, any clean procedure. It is a clean procedure. No need any sterile methods, so we can do it bedtime. We can do it near to the bed, not bedtime, near to the bed. and it is the easiest method, convenient, and I think from the ECG we can notice wide variety of heart problems, even if the heart block, myocardial infarction, any left ventricular hypertrophy, any muscle damage, like that, we can identify. So it is the best method before going to the any big procedures like echo and invasive procedures. It's the best method.
Okay, thank you, ma'am. Thank you for finding time out of your busy schedule. It was a very informative session. It was really helpful. Thank you for summarizing this wide topic in a short
Clear.
period.